This is the news in brief from the United Nations. A deal on Wednesday to release hostages taken during the Hamas terror attack on Israel has been welcomed by UN Chief Antonio Guterres. He said that the UN stood ready to maximize the positive humanitarian impact of the agreement. This is an important step in the right direction, but much more needs to be done, Mr. Guterres said, via a statement from his spokesperson Farhan Haq. The top UN official leading efforts to secure a lasting peace in the Middle East, Tor Wennesland, also welcomed the announced 96-hour humanitarian pause in war-shattered Gaza. In his statement, Mr. Wennesland welcomed the efforts of the governments of Egypt, Qatar and the United States in facilitating the agreement. UN humanitarians have reiterated that they remain ready to seize the opportunity to ramp up life-saving aid to the enclave. Meanwhile, the UN agency WHO said that a new evacuation of critically ill patients and health workers was underway at Gaza City's embattled Al-Shifa hospital, with more to follow in northern Gaza. To the Democratic People's Republic of Korea, DPRK, commonly known as North Korea, whose military satellite launch has been strongly condemned by UN Secretary-General Antonio Guterres. In a statement issued by his office, Mr. Guterres recalled that any launch by the DPRK using ballistic missile technology is contrary to the relevant Security Council resolutions. The UN chief reiterated his call on the DPRK to fully comply with its international obligations under the resolutions. He also urged the country to return to dialogue without preconditions to achieve sustainable peace and the denuclearization of the Korean peninsula. More than 330,000 doses of the world's first WHO-recommended malaria vaccine have arrived in Cameroon. The UN Health Agency hailed the development on Wednesday as a historic step towards broader vaccination against the disease. This is another breakthrough moment for malaria vaccines and malaria control, said WHO Director General Tedros Adhanom Ghebreyesus, who called for malaria vaccines to be scaled up so that more children can live longer, healthier lives. Nearly every minute, a child under 5 dies of malaria, which according to the World Health Organization is one of the deadliest diseases for African youngsters. The continent accounted for nearly all global malaria cases and related deaths in 2021. The delivery of the RTS vaccine to Cameroon is the first to a country not previously involved in the malaria vaccine pilot program. Several African countries are now finalizing plans to roll out the new vaccine, with an additional 1.7 million doses set for delivery to Burkina Faso, Liberia, Niger, and Sierra Leone in the coming weeks. These shipments signal that malaria vaccination is moving out of its pilot phase and that countries are laying the groundwork to begin vaccinations through routine immunization programs in the first quarter of 2024, WHO said. Dominika, Tomaszewska-Mortimer, UN News.